understanding and addressing vaccine hesitancy within the Muslim community, and especially approaching it from an Islamic perspective. In this particular episode, we will be looking at vaccines. What are they? What is vaccination? Who is behind vaccines? Who produces? How do they work? What are the major companies involved? And the concern over side effects, the harm and the benefit. Is the benefit really greater than the harm? I'm your host, Muhammad Nuruddin Lemu, and with me to discuss today's topics are two of our distinguished visitors, science background people, starting with Sister Basira Raji, who comes from biological science background and a master's in pharmacognosy, Brother Muhammad Al-Hassan, who comes from a microbiology background. You're both most welcome to the program. Jazakumullahu khairan and assalamu alaikum.
Wa alaikum assalam.
I'd like to start with the first question for both of you, but starting with Sister Basira. What exactly are vaccines? In simple layman's language, what's a vaccination? And tell us more about vaccines, vaccination. Bismillah.
Vaccines are biological products that are mainly to strengthen the immune system of human beings, most especially individuals that have weak immune systems against a particular disease or related diseases. And how these vaccines work is they are being extracted from a weak part of the vaccine or the dead part of the vaccine, the virus, most especially related to the organism or the disease in particular or in question. So the particular vaccine, the weak part or the dead part of it is being extracted, and then the active agent of it is being broken down into what it's used as a vaccine. So there are various ways by which this vaccine is being administered into the body. We have it been administered through, it can be administered through the mouth, through the nose, and through, deferral injection, which we are most familiar with. So when you administer it through the nose, we are making use of this nasal filled, sprayer, which is being transferred through both nostrils. An example of that is the live annotated virus that is mostly, vaccine against influenza. And then if it is administered through the mouth, the oral administration of vaccine, we are making use of the rotavirus that is administered to just open your mouth and then swallow it. Then the one that is being administered through injection, we are quite familiar with the poliovirus that is administered through the subcutaneous tissues of the body and other parts of the body. So basically what vaccine does is to strengthen the immune system of an individual against a particular disease that is supposed to protect or lead to foreign or any harm of fighting the pathogens of the body.
I know for babies, not just of humans but other mammals, one of those things that medical professionals insist on is that the baby should drink the colostrum, the first milk. It's not really milk, but that colostrum that comes from the mother, because that helps boost the immune system of the child from some of the diseases that the mother has gone through. In other words, she is more like vaccinating her child by helping the child boost its own immune system. But what we have now, from my understanding, is with vaccination, it is more targeted. It is how you boost the immune system of anybody by giving them a small dose of the weakened virus or or a dead part of it that still has the memory, so to speak, of the actual dangerous virus, but it's given in such a dose and with such a weakened form that is enough to educate the immune system so it is prepared, but at the same time not enough to harm the individual. What more could you share with us, Malam Al-Hassan, about vaccinations, immunization, etc.?
So Alhamdulillah, I think basically, like my sister has mentioned, vaccination or immunization is the process where the body is prepared against infectious diseases, especially as a result of a vaccine, typically as a result of a vaccine that is being injected into an individual. If I'm going to use a metaphor, I would say vaccination is like, vaccine acts like an army that comes to train the individual's immune system. It shows it the blueprint so that by the time the infectious organisms or the pathogens comes into the system, these soldiers of the body are prepared enough to know how to really fight against these organisms. Usually, you could have the complete, what you may call complete immunity or the partial immunity in vaccination. And for complete immunity in some vaccinations is where the memory of the cells are able to take this information, to keep this information long enough, so that anytime there is a kind of a pathogenic infiltration into the system, they are able to recognize it immediately and they are able to fight it. In the partial immunity, the memory sometimes is not able to keep it for long, or they are not able to completely eradicate the organisms from the body. And so what it does is it's able to reduce the kind of illness that may affect this individual, basically. Vaccines have been in existence since about 1,000 years ago in places like India, China, and in the 18th century, you have the British physician Edward Jenner, who used some experiments from this cowpox. He was able to identify how cowpox could be used as a vaccination against the smallpox diseases, and this has led to a complete elimination of the smallpox virus, which was officially announced by the World Health Organization in the 1980s. And this has also paved way to the lots of new things that are happening in the vaccine world today, basically.
I like the metaphor of vaccines being like soldiers sent to train your body to prepare for a bigger army that is coming. And that these are not new, as you've mentioned, and it's not just for humans, it's also for animals. Sister Basira, could you tell us a little bit about what's in vaccines? We're told that they are these soldiers that train our body, but in a more precise manner, what's the ingredient? What goes into it?
So like other definite packages products that we have on like other medications, there are ingredients that make up this particular medication or drugs. And so like the vaccine that we have some key components or some key ingredients that, they may vary, but at least they are part of what makes up the vaccine. So we have 6 components of ingredients that we have. The first one is the antigen. It's like, that's just as I've said, the weak or the dead part of the causing organism. So it can't harm the body, but it is needed to just recognize like a blueprint, like we said. And the second one is the adjuvant, which is also to enhance or maintain or boost the immune system further. And we have examples of aluminum, sodium, and some other products that are used as an adjuvant. Then we have the third one, that we have the preservatives. Unlike other preservatives that are used to extend shelf life, this is used to prevent contaminations to the vaccines, more like contaminations from fungi, contaminations from bacteria, and some other viruses that are not the causing organism. And then we have the stabilizers, just like we are familiar with normal stabilizers that are used to prevent power surge into the home. This stabilizer is used to prevent, to maintain the environmental condition, the pH, the light, and other aspects of the vaccine. And not just that, it's also made to, to maintain the effectiveness during the long-time storage before the vaccine is being used. So it maintains it and makes sure that the effectiveness doesn't run down. Then we have the diluents. Diluents, like a dilution procedure that is being used, more like a liquid that is being used to dilute the vaccine. And it's not just dilution, it is being to dilute it into a correct concentration that is needed for the vaccine to work effectively. And then the last one that we have is the residual trace that is being produced after, or is being left after the vaccine is being administered. And most times this is found in the body and in forms of formaldehyde. So these are just the 6 components or the 6 ingredients that may vary in some different vaccines. So, but at least this is the key ones that we have.
While you're still at it, so like anything, if you want to make tea, there's ingredients. If you want to make jollof rice, you've got ingredients. If you want to make medicine, there's ingredients. If you want to make vaccines, there are these ingredients. Who's behind vaccines? What are the companies? Are these, just who's behind them? Are they the same people who produce our other medication? Are they some special group? What could you educate us about the manufacturing?
In the world now, we have a lot of pharmaceutical companies, but we have the ones that we, on a constant daily basis, when you go to the hospital and you complain about a problem to a doctor, there's a particular drug being, prescribed to you, and you buy the medicines, and then you feel safe that whatever is coming from the doctor or whatever the manufacturer is giving you is safe. And this set of pharmaceutical companies are the same set of pharmaceutical companies that produce these vaccines. So of course they are safe and they are encouraged to be bought. So part of those pharmaceutical companies that are worldwide and that are a bit more recognized, I think we have more like the Pfizer company, which is most of our normal biological products, medication, drugs that comes from them. And then we have the Roche's Holdings that deals with other things that has to do with the treatment of cancer, viruses, diseases, and other related diseases. And then we have the Moderna corporation that deals with, they deal mainly with RNA or therapeutics, prevention of the diseases, most especially primarily to the mRNA that has to do with messenger RNA. They are in the treatment of influenza, in the treatment of HIV, in the treatment of single shots COVID-19 booster. So in summary, we have like 4 different types of manufacturing companies that we recognize, and then that we buy. They are the same set of pharmaceutical companies that produce our drugs, that produce our medications, antibiotics, and other aspects that has to do with cancer treatment, oncology, cardiology, things that has to do with immunology, even boosting of our immune system, and also aspects of cardiovascular diseases. So these are just basically what I'm trying to say is that we have several pharmaceutical companies ranging from the Roche's Holding that is head by in Switzerland by the Swiss Holding Company. Then we have the Pfizer company, which is an American multinational company that is held in the USA. Then we have the Moderna, also an American multinational pharmaceutical company that is in USA, also in Cambridge, USA. And then we have the Johnson & Johnson also that's into other aspects of pharmaceutical products.
So from what you're saying, for anybody who has been to a hospital or has taken medication over the last 5, 10, 15, 30 years, you most likely have already taken some medication coming from one or more of these companies. But these are the same big pharmaceutical companies that produce the medications, the skin creams, the paracetamols, the medicines for various illnesses. And so they are well known, they've established credibility. Of course, they are not perfect. They themselves are run by humans who make their mistakes also, but at least compared to others, these are some of the best authorities on the subject area. Al-Hassan, on the issues to do with the working of vaccines, before we go into the concerns on side effects, because I'd like it to segue into that and move into that discussion, could you say a little bit about how vaccines work? You used a metaphor before. What more can you say as we move into the issue of how then do they produce side effects? What would you say there?
Thank you very much. So basically, when the vaccine is being introduced into the human body, it ignites an immune response. And this immune response is where the white blood cells, which of course is like the army of the human body, produces cells like the B cells and the T cells. And so it produces the plasma B cells, which are responsible for, they go to engulf this organism, they neutralize these pathogens, and then they send them out of the system, while the memory B cells, together with the memory T cells, will copy the mechanism of this particular antigen, which is of course the protein that comes in together with the protein components that comes in with the vaccine. And so they ensure they keep that memory so that anytime in the future when the real pathogen, the one that is capable of causing harm, comes into the system, the memory B cells and T cells then reactivate. Immediately they go into action, and then they differentiate, and then it differentiates into another plasma cell, which immediately goes into action to neutralize these real organisms and also eliminate them from the system,
basically in a very scientific way. But in simple language, what you're simply saying is the vaccines educate the immune system in a very sophisticated manner, mashallah, to be able to deal with problems that are much bigger than the teacher, so to speak. It reminds me of how the body responds to carrying weights. So if you're into weightlifting and you've never lifted a weight before, or you've lifted a suitcase of 20 kilos, but you've never carried more than 30 kilos, you find that just carrying 20 and 30 kilos, your muscles respond by being able to carry 50 kilos, even though you've never taken 50 kilos before. But if you start carrying 50 kilos, your muscles build to prepare to handle 70 or 80 kilos. In other words, that stress given to the body, while nobody likes the pain from the muscles tearing or the stress on those muscles, what happens after a while is the body gets educated by the weight it is lifting and is now strong enough to carry bigger weights, heavier weights. And so in a similar way, probably from what I understand, as you take these vaccines, and I would like to look at this question of side effects. Yes, there's an impact on the body of taking vaccines, I guess, like most medications, but it affects some people in different ways. But the response is that the body is now able to handle a bigger version and a stronger version and a higher dose of the virus. Consequently, what comes out of this whole process of vaccination is a body that is a stronger survivor. So even though the disease didn't go away, it's just that it's no more disturbing you the way COVID is not disturbing dogs or it's not disturbing birds, it's just disturbing us. But how do we develop that? Taking that discussion, some people have complained about side effects. What are some of the most common side effects of vaccines in general? Some would say, oh, this one causes this, and all sorts of things. What's true, what's not true. But from the studies of people the medical professionals who study side effects of vaccines, what are the most common that have been identified?
So thank you very much. I think just like the metaphor you gave just now, a lot of the times you'll observe by the time people go through those kind of strenuous exercises, they have some kind of body pain. Sometimes some people have to stay for some days before they are able to recover again, especially if they don't carry on with exercise continuously. So I think similarly for the immune system, for vaccination, by the time the vaccine is introduced into the system and the memory the white blood cells are doing their job by trying to eliminate this organism and trying to also have an information and blueprint about it for the future, any kind of a future invasion. What happens is during that process of all those activities, a number of things can happen to our system and depending on our body composition. And so you will observe that sometimes it is not the kind of symptoms, do I call it symptoms? It's not the kind of side effects that you would have that I would have, and it's not the kind of side effects I would have that somebody else would have. And so you find people who, by the time they have taken vaccination, they go down with light fever, some with chills, some form of cold, some will cough, some with catarrh. Sometimes, even in kids, sometimes when they are vaccinated, you will see the area will be swollen up and then it will become reddish and a lot of other things. Sometimes when this vaccination is given, especially due to the kind of components that may be of the items that may be in the vaccine, it can result in some form of allergies, and so people react in very different ways. And you will observe sometimes in some of these hospitals or medical facilities, when vaccination is being given to people, they are being observed for like between 15 to 30 minutes just to see if they are going to react to it. And usually that is just to ensure that whatever kind of reaction your system is going to have to this, depending on the nature of your system, the medical practitioners are there to help. So just to say, these side effects that we see in vaccines is actually a natural process that would happen because of the activities that are happening in the system, basically.
And I think the same, nearly every medication you buy will tell you there are certain side effects that you should expect. But then for most people, you don't have. So there actually are side effects that are rare. But because they happen, doesn't mean the vaccine is not working and doing its job. As you said, the issue of muscle building. I remember when I was a teenager, I think I had just finished university, and I went to a gym to try and do a little bodybuilding. And so day one, you will carry these weights and dumbbells and do your thing. Day two, day three. Then the coach said, come back after 2 weeks. And I said, after 2 weeks, I'm ready to do every day. He said, no, if you do every day, by this coming weekend, you will have malaria. You will have a fever. And I was like, what is he talking about? So after 2 days, I came back. He wasn't around. And I did some little extra. 3 days later, I was down with a fever. Because the body was responding to the stress that was more than it could handle. But at this, at the same time, when we therefore look at all medications, in fact, foods, some people are allergic to honey. Some people are allergic to groundnuts. Some people are allergic to various foods. While these allergies exist for some people, while there would be side effects for some people, I took COVID vaccine. I had the whole 3 doses, booster 1 and the others, but I didn't get any side effects. I didn't know what people are talking about other than, the pain of the shot, like any other medicine. There's still the understanding in the medical community that the benefits are greater than the harm. That in spite of all this problem and side effects affecting a percent of the community, that it is still better to have the vaccinations, manage these side effects, but at least at the end of it, you've prevented others and you've prevented yourself from having it, of course, depending on the vaccine, whether you need another round or not. But I would like to ask Sister Basira, in view of the side effects, what are those major arguments that are used to say the benefits are still greater than these side effects?
Just as Malam Ali Hassan has said, vaccination is just the application, the act by which you get the vaccine. But immunization is the response of the body to the vaccine, resulting into long-term or future protection. So irrespective of the side effects or other as far adverse effects that might come from this application of this vaccine or administration of these vaccines, there are also some benefits that cannot be just laid aside, and part of them are the prevention of the diseases. Of course, after getting the booster of the immune system, there are some other factors that can be looked at after during the time by which the vaccine is being administered to the body, and that is the prevention of the disease, because it helps to boost the immune system by, at first it's recognized because there's already a blueprint instilled in the body, it's recognized, and at the same time it fights off the pathogen, and by that it significantly reduces the level at which the disease is being spread from one place or one person to another. And at the same time, just as we know that during the time where polio virus was outside and smallpox virus were rampant, then if there wasn't a level at which there was the vaccine administration to those who had the disease at that point in time, we wouldn't be able to talk about it or be able to know about what is happening now, because a lot of people will have have the diseases and will have died, and there's nothing we couldn't have done about that. So it has been able to prevent, what vaccine does, has been able to prevent the diseases. It has been able to guide us by boosting our immune system, and it doesn't make it just when it happens that we are just there and the body is not responding, but it boosts the immune system and it responds effectively to the vaccine that is been administered. Vaccine has been able to save a lot of lives, millions of lives actually, most especially to children, because of the level of polioviruses and smallpox viruses. A lot of children born nowadays might not even know what's poliovirus, or essentially except if they read it in a book. So it has saved a lot of lives, and it has prevented a lot of people dying, and it reduced the mortality rate at which and through the vaccines that's been administered to people. And it's not just that, it has played a vital role in reducing the mortality rate, helping us to have a progeny that continues in existence.
And I think, this issue of saving lives is at the core of Islamic teachings. But it's not just saving lives, it's also preventing people from being crippled, reducing the need to go to hospitals, the cost of going to hospital, depending on the disease. It's easier to get vaccines to people than to get people to hospitals. What else would you add, Mala Al-Hassan, to this issue of the benefits of vaccine that make people feel it's greater than the side effects?
So I think, alhamdulillah, to add to what my sister had mentioned, part of the benefits of this vaccination is that it also creates what you call herd immunity. In another word, it's usually called either herd immunity or community immunity. And from the nomenclature, community immunity, it is when you have a larger population of people in the community that are vaccinated and are immune against a particular disease, such that even when there is going to be an infection of very few people in that particular community, because of the large numbers of people who have been vaccinated and that they can't even carry this disease, those who are immunocompromised, the newborn babies who don't already have this strong immune system, those with underlying conditions like hepatitis, diabetes, and the likes, are saved from any form of infection that may really come out at a particular point in time. And from the Islamic point of view, the concept of maslaha, which has to do with community goodness and welfare, is so very important, and it's every individual's social responsibility. It's basically a social responsibility for every individual.
Basira, would you add more to this?
Vaccination has also helped to reduce health costs. It helps to reduce hospitalization. Of course, when people are sick, you have to go to the hospital. So it reduces the rate at which people get hospitalized. It reduces the rate at which people need a lot of treatment. It has saved a lot of costs that can be useful for other growth of the nation. So it has helped to protect future generations in a way by which I remember growing up when we have to go for poliovirus vaccination and smallpox vaccination. For those that are just born now, they might not know what this means because they didn't go through this process. Vaccination has helped to eradicate a larger percent, if not all, reduce the rate at which this particular virus is rampant in the society. So for them now, it's just for them to read it in a book. They don't even know what it means because they didn't go through it. So it has helped to protect the future generations and, increase and make it easy for other generations that are coming to live safe. And at the same time, vaccination has helped to eradicate diseases. Just as I've said that it has reduced the life-threatening diseases that is infectious to every one of us, because, vaccination has curbed it at the nip of the bud. It's something that can go wild, but when someone is vaccinated in this family and some other person is vaccinated in this family, it eradicates the rate at which it can spread into the community. So it's not just an individual responsibilities alone, it deals with the community. So when you do your responsibility here, your responsibility is have to eradicate it at which this particular disease is being spread.
And I think, the point you made about preventing the next generation from dealing with a particular disease, one can look at smallpox, which alhamdulillah has been eradicated. But if you look at pictures of people with smallpox online, it was a horrible killer. You really pity the families and those who are going to have to help the victim, and of course the victim. And if I recall from one fact that was shared by a healthcare professional, in those days, about 300,000 people died every year as a result of smallpox. So when it's eradicated, you can multiply over the years how many people have actually been saved. And even though you say, well, the world today is nearly 8 billion people, and 300,000 or 500,000 or 1 million is still a very small percent. Yeah, if that person is not related to you, it's a very small percent. But a small percent of a big number is a big number. You know, a small percent of a big number of 8 million, even 0.1%, 0.01%, 0.001% of 8 billion is a huge number. And alhamdulillah for vaccinations that have not allowed us to inherit more diseases, because we are finding new diseases coming. You know, so one of those points you were making, that it keeps some diseases, eradicates them, so the future doesn't need to start having more diseases. And now nobody's taking smallpox vaccines because it's been eradicated. What would you add as we come to an end of this session on the importance of these vaccinations?
So Alhamdulillah, I think just to recall the hadith of the Prophet ﷺ when he says, for every disease that Allah has sent, Allah has of course descended its cure. Vaccine generally, Alhamdulillah, has improved quality of life, like my sister has mentioned. And you could see that one, basically, if you are going to look at it, in the community where there is vaccination and most of these deadly illnesses that sometimes could paralyze are avoided. What will happen is you have fewer sick days. One does not have to really be in the hospital, and that also implies lower cost that one has to actually spend on healthcare. And basically, when you have to spend less in healthcare, you also that also implies that you have more money or more resources to also be able to use in other aspects of your life. So basically, alhamdulillah, I think vaccine will go a long way to improving the quality of human life.
Thank you both so very much for this elaboration, that yes, there are side effects, there are harmful aspects of vaccine, as with food, as with drinks, as with other medications. And I would like us to look more closely in other episodes about the reasons for hesitancy beside the side effects. In the sense, everybody says, yeah, okay, side effects. But inshallah, in subsequent episodes, we will be looking more at some of the arguments or claims, such as the ingredients of vaccines. Is it all halal? Is it true that vaccination is supposed to be a system for controlling fertility and population? And many of these, inshallah. But for now, I'd like to thank you for your contributions, Brother Muhammad Al-Hassan, Sister Basira Raji, Jazakumullahu khairan. Until next time, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
بسم الله الرحمن الرحيم